If you're going to remember one slide from today, if you're like going to take one screenshot, and again, I'll share these around, it's probably this slide. Really, what are the sort of candidate processes or intervention domains that if you were to use the resources that currently exist in your school or seek additional support or funding, where are the areas that are likely most evidence informed to be helpful to those challenges? Not every kid experiences all of these challenges. The sort of constellation is different, but these are sort of those core domains. So on the left, resettlement, acculturation, isolation, and traumatic stress, common challenges for refugee and immigrant kids. On the right, for resettlement, key strategy for, in particular, school-based interventions are about promoting stability and agency. For acculturation, we're often talking about facilitating intercultural exchange and cultural identity exploration. And Sarah alluded to this in the intervention that she was talking about as well. For isolation, we'll talk about nurturing connection and belonging, and I'll maybe hang on those slides a little bit longer than the others because that may be one area that we haven't touched on quite as much. And then the third is, I'm a psychologist, so thinking about traumatic stress, so thinking about promoting safety, building skills, and restoring power. And the important thing is, I'm a psychologist, and when I was in grad school, often we spent a lot of time talking about this bottom tier. However, for a school-based mental health provider, or a clinician as well, there's so much value in those top three domains that are often very, very important in order to set someone up to be able to receive higher levels of care for clinical services. I'm Jeff, you can call me Jeff. I'm a psychologist and a researcher based in Boston, and I'm specifically going to be speaking about a framework from our group called the Core Stressors Framework to try to organize some of the content that's been shared already today. A lot of this is grant-funded work. In particular, we're really thankful for our funding from the National Child Traumatic Stress Network for a lot of this work. As we said in the previous talks, refugee and immigrant mental health is a team sport. So I'm just one person here, happy to be on an awesome team. These are a couple of photos of various permutations of that team over the past couple of years. And part of also working on an effective team is really partnering with the folks that you're really trying to serve in the communities you're trying to serve. So we're a program based in Massachusetts, but we work with programs all over the world. These are a couple of photos just from the recent times, although I think I'm wearing the same shirt and pants in one of them, which is kind of funny. I'm just realizing that. With other programs. It's a program in Boston on the left, in Minnesota on the bottom, and a community center I was in Vermont during COVID. I found that photo recently. So as has been stated already today, but I'll just reorient this dialectic, these multiple truths, which is that forcibly displaced youth and families, as we all know, if you're opting in for today, are amazingly resilient and can make enormous contributions to their communities. And this is part of the fabric and the history of the United States over hundreds of years. And many youth and families understandably suffer the downstream effects of systemic trauma and oppression. I work in refugee and immigrant mental health, and particularly kids who've been forcibly displaced. And so when someone's been forcibly displaced, they're often leaving because they're seeking refuge, seeking safety, seeking an opportunity to build a life of meaning and purpose. If we have the opportunity to be helpful, then that is hopefully our mandate. Now, one of the major challenges in refugee and immigrant mental health, or North American resettlement in particular, is that it's very hard to organize, as the previous talks both oriented to, organize services thinking about how do we put scarce resources to use. And so our team at Boston Children's has worked to develop and advance a framework for thinking about core stressors that are experienced by refugee and immigrant kids when they're resettling, as a way to organize both assessment, triage, and then service delivery. And so this is the four domains that we're going to talk about are resettlement stress, that's top left, acculturation stress, isolation stress, and then traumatic stress. And each of these, that's a photo of a young man named Miguel. There's a profile in the New Yorker about him, and it's in the public domain, and he's talking about a lot of the challenges of coming from El Salvador to the US, and he's alluding to all of these different domains as he's talking, as do many kids who have experienced some of the things that he has. So the core stressor framework is a tool and a toolkit from our center. The book that Ariana mentioned that I co-authored, we use that as a framework for throughout the book for trying to organize, again, service, assessment, triage, and service delivery. This gets a little bit more into the specifics around what each domain sort of contains, and then how we want to be thinking about it. One piece that I'll allude to at the end is we have an online toolkit. I'll try to put it in the Google Doc at the end, where providers, school-based providers can go through it and sort of conceptualize individual kids using that. Again, Amanda and Sarah both alluded to some of these tools. And this is a way of just trying to organize all of the great work that you're doing and thinking about how do I put this into place for this particular kid or family in a culturally responsive and trauma-informed way. And so really, if you're going to remember one slide from today, if you're like going to take one screenshot, and again, I'll share these around, it's probably this slide. What this slide is communicating is on the left, you see common stressor domains, and I'll break these definitions down just to make sure people have them, even though they were alluded to in the previous talks. But then really, what are the sort of candidate processes or intervention domains that if you were to use the resources that currently exist in your school or seek additional support or funding, where are the areas that are likely most evidence informed to be helpful to those challenges? Not every kid experiences all of these challenges. The sort of constellation is different, but these are sort of those core domains. So on the left, resettlement, acculturation, isolation, and traumatic stress, common challenges for refugee and immigrant kids. On the right, for resettlement, key strategy for, in particular, school-based interventions are about promoting stability and agency. For acculturation, we're often talking about facilitating intercultural exchange and cultural identity exploration. And Sarah alluded to this in the intervention that she was talking about as well. For isolation, we'll talk about nurturing connection and belonging, and I'll maybe hang on those slides a little bit longer than the others because that may be one area that we haven't touched on quite as much. And then the third is, I'm a psychologist, so thinking about traumatic stress, so thinking about promoting safety, building skills, and restoring power. And the important thing is, I'm a psychologist, and when I was in grad school, often we spent a lot of time talking about this bottom tier. However, for a school-based mental health provider, or a clinician as well, there's so much value in those top three domains that are often very, very important in order to set someone up to be able to receive higher levels of care for clinical services. And so often we're trying to orient people to these other three in addition to more traditional sort of traumatic stress interventions. So I'll move through these, and so I have them set up as what I set them up for today is as the domain, and then explaining the domain, and then a practice example. And again, so I'm just reiterating these ideas, so hopefully folks are able to walk away with something you can put into practice. So resettlement and resettlement stress in particular, we're talking about foundational needs for health and safety. And so these are things like housing, nutrition, healthcare, transportation, employment, and education, and then legal and immigration services. Now, how someone comes to the US through what mechanism, whether they're an asylum seeker or a formally resettled refugee through the UNHCR, or coming as an underdocumented kid, or coming as an economic migrant, there's lots of permutations. What's important about that is the legal status sets up access to lots of different services. And so like even in Massachusetts, for example, there are certain services that some kids, based on their documentation status, can access where others cannot. And so for school-based mental health services for kids who are underdocumented, even a safety net insurance, so the insurance that's set up to support kids, kids often don't have access to. So this is a big challenge. And so it's very hard to engage in a lot of other services if you are not sure where your next meal is or how to get to the hospital or how to get to the school. And so that's often where a lot of initial resettlement resources are focused. The challenge is that once folks have been here for a little bit longer, a year or two, then some of the infrastructure that's set up or the receiving setup is not there as much. And so then other more local organizations are often stepping in. So what we're trying to do is promote stability and agency. What does that mean? So promoting stability, again, thinking about school-based context, is assessing needs and supports. So trying to figure out in a culturally responsive, linguistically appropriate way, what is going on and how do you know it? Again, multiple examples were given in the previous two talks around clarifying the actual needs and then ensuring access to those specific needs, and then doing a 360 around, does this family have all the needs, the basic needs that will be important for a kid to be able to learn and be effective at school? The other thing is promoting agency. So often There's an intense sense of disempowerment that can happen. This is for forced displacement in particular. And so how do we give the power back to the kids or families where it's been taken from them? So ensuring opportunities for learning, ensuring opportunities for skill development, and then ensuring opportunities for voice and choice. So the last thing someone needs is a random white man from an academic hospital coming in and saying what to do at them. What people, if I can use my relative power or privilege as a white man in that context, is to open up the opportunity for conversation and for this curious collaborative listening. Easier said than done, but that's the pathway forward for a lot of these things where we can sort of work effectively and collaboratively together. It's what most human beings want when you're trying to solve a problem. So then these are, and again, I'll share these slides, specific school-based strategies for promoting learning. That's at the individual level, creating systems, which is the infrastructure of a school, and then building community, which is how do you attend to this sort of psychological, social belongingness processes. So promoting learning, thinking about student welcome materials. I'll just give one example per each. For creating systems, formalizing the intake procedures for new kids coming into school. For example, what are the ELL assessment tools that you're using, and are they up to date? And then building community. How do you establish really thoughtful community partnerships? Amanda alluded to this around really connecting with the folks in the community doing the work that's important. And how do you connect with those partnerships proactively to be able to build bridges for the kids you're trying to help? A practice example, this is a tool from our center, which is a universal screening tool for refugee and immigrant kids, where it assesses across those 4 core stressors. And then we're currently involved in some projects where we're trying to continue to test the effectiveness of this to orient kids to triage into particular services. But the main thing is, does your school have universal screening? If not, how could you get there? Or what are the steps that you go to start some amount of mental health screening for youth in your school in a way that's, again, linguistically appropriate? So acculturative stress, Sarah alluded to this. When we think about acculturation, the sort of that formal definition is how individuals change and adapt as a result of longer-term continuous contact with a new culture, and how thoughts, behaviors, identities are oriented towards this sort of new cultural context. So say you're now in Massachusetts, and that's the new cultural context, as opposed to the sort of heritage cultural context. So in Miguel, and the example from the beginning, from El Salvador, from the community that he was a part of. Often in acculturation, and the acculturation itself is a huge academic domain. The terms you may be familiar with are these assimilation, separation, marginalization, and integration. That's called like Berry's, 4-component model. The key idea is that the best outcomes, not always, but often across lots of studies, and then what are called meta-analyses, so studies of many studies, is something called an integrational acculturation strategy, which is really this both-and approach of how do I hold the pieces of my heritage culture that are working for me and my community, and how do I hold on to these new elements to, again, both-and these strategies. And so you think in schools can be this push-pull context where kids are trying to connect and build relationships while also potentially feeling pressure to push certain elements away. And so often what we're trying to do with kids is how do we facilitate those both-and approaches? That doesn't mean we do them all at once. Sometimes we have to sort of move one thing forward and bring one thing back, but creating the language to be able to navigate some of those things and creating spaces for kids to discuss those things. And so just for sake of time, I'll move to this. So similar to the tier 2, sort of the preventative group-based intervention that Sarah was alluding to, our team has a whole constellation of interventions based in a program called Trauma Systems Therapy for Refugees. And we have these, they're called skills-based groups that are really focused on helping support a culture of stress and belongingness. And so either groups that are ethnoculturally specific or ethnoculturally diverse, giving kids an opportunity in a group setting facilitated by usually a clinician and a cultural broker, so someone like a family navigator or a family liaison, to co-facilitate these conversations where kids are learning around cultural adaptation, cultural change, moving from one context to another, interpersonal conflict sort of strategies and dynamics of living in a new context, and then some preliminary sort of emotion regulation, cognitive skill building that sets kids up to be effective at school. If kids Mental health isn't attended in schools. It's very hard to learn, and many kids benefit from, again, these low stigma, high sort of group collaborative ways where kids can learn from supportive adults and peers. So that third domain, so we've gone through resettlement and we've gone through acculturation. Now we're talking about isolation stress. So refugee and immigrant families in particular are extremely vulnerable to social isolation and loneliness globally, and the US in particular. We're in this massive epidemic of loneliness and isolation. If people haven't had a chance to look at the Surgeon General report from 2023 on loneliness and social isolation, it's an amazing resource with tons of great stuff. And our group has had the opportunity to connect with that team on that resource. And we're sort of trying to move some of these ideas forward. A really important idea when thinking about how to support students in your school related to isolation is having shared language. And the key shared, or a key element of shared language, is knowing the definition or the differences between these two terms, which is, what's isolation? Isolation is an objective term about few social relationships, few roles, few group memberships, and infrequent social interaction. And if you're a kid who's resettled in a context where there aren't a lot of kids who speak your language or from your culture, that is an objective risk factor for social isolation. Loneliness is the subjective experience of how those relationships are sort of working for you. So someone could have few connections but not feel lonely, or someone could have a lot of connections and feel very lonely. So we often are trying to attend to both of these. They're correlated, but they're not the same thing. Why is this important? Social isolation, that's the psychological process. And then again, social connection is the objective process. Not having those social connections is very dangerous for our health, because it sets us up for a host of challenges. And this is often particularly true for refugee and immigrant kids and families. And so we want to, in schools, really anchor on, if we're thinking about few other things, one of the things where schools are amazing at potentially trying to do this, or potentially extremely toxic in not doing this, is nurturing connection and belonging. So schools are the place where kids spend the most number of hours, for the most part, in the day, or very close, depending on if you count sleep or not. So nurturing connection, what does that look like in your school? Creating opportunities for bonding, bridging, and linking, and I'll explain what that is, around building social connections in a very sort of concrete way that leverages all of the amazing assets that already exist in your school. And then nurturing a sense of belonging. So that's the social connection, the objective. Nurture a sense of belonging, that's the subjective. How do you support a culture where we're focused on building connections as opposed to fitting in or blending in? And how do we foster cultures that really attend to the diversity of social ecologies or school ecologies? Sarah showed the sort of classic Bronfenbrenner ecological systems model. So when we're thinking about kids and programming, we need to think about a kid embedded within friends, embedded within classrooms, with embedded grade within a school. And that's how thinking strategically within schools. And I'll go for, I think, like 2 or 3 more minutes. So this one is an example for that bonding, bridging, and linking framework, which is a sort of a well-established social capital, social connection framework that our group has done some work on. And in particular, when you're thinking about either individual kids or communities of kids within your context, we're often trying to promote all 3 of these domains, although different kids have different strengths and vulnerabilities in terms of what's higher and what's lower. So you can think of each of these as, you could be sort of on a scale from low to high. So bonding are connections with someone who has similar sociocultural identities and experiences to you. So someone who shares a lot of overlapping experiences. Bridging is a connection or connections with someone who has differing social cultural identities or experiences. So there's something significantly different about your experience or your sort of the way that you've moved through the world. And then third is linking, which is connecting someone. So imagine a kid connecting to someone with more relative power than themselves. So like a teacher or a police officer or a principal or a person in a position of elected authority. And the more that we can foster these types of social connections, in particular bridging connections, for certain types of refugee and immigrant kids, can be really valuable. So we want to be thinking in schools for the programs that we work with, how do we foster ethnic identity support, with kids of similar backgrounds. So getting all the kids who are from Somalia together to spend time together to connect in a group that's facilitated by someone who speaks Somali, for example. Bridging is then, how would you help connect some of those boys to some of the other kids in the community that maybe those are white boys who grew up in that particular context. Their family's been there for generations, but they all love soccer, and together they can connect through that love of soccer across their ethno and racial differences. And then linking, what would it be like if you connected that whole soccer team to the mayor of that town in a way that they can collaboratively talk about, what would it be like if we worked on building a new soccer field or redesigning these goalposts so that they are more resilient to the weather. And so these are the types of community resilience programming that you can do in schools and towns that are concrete, actionable, and can make an enormous difference. I've got like 1 minute left. Lots of strategies for thinking about social connection building in schools. We've got some other examples. The last sort of piece that I'll say is that if you're thinking about trauma and resilience in context for refugee and immigrant service delivery, we often need to be thinking around group-based, again, culturally sensitive, community-oriented interactions. So Amanda was talking about we need to involve parents and caregivers in the discussion. You cannot overstate the value of involving community members, the folks who are doing the important work. They may not have a particular degree, but there's someone in the community doing the work, or the parents or caregivers who are involved. The more that you can bring folks around the table to discuss these things, the more likely that we'll sort of get to some of the solutions that we're looking for.